The college's position statement on antimicrobial resistance. So the college has developed a position statement based on human health regarding antimicrobial resistance to detail what its members, medical microbiologists and virologists, need to tackle this issue successfully. So why create a statement? Well, we know it's important. That's why we're all here today. Recent study said globally 1 million deaths are directly linked to bacterial AMR and 5 million indirectly. WHO also predicts that AMR will cause 39 million deaths worldwide over the next 25 years, and that's equivalent to over 3 deaths every minute. Now, it's also known as the silent pandemic, and we want to move it up the agenda. Secondly, medical microbiologists and virologists are key to addressing AMR. They're responsible, as we've heard previously today, for the provision of diagnostic services and advice to clinicians, including infection prevention and control measures, and the provision of expertise to public health services, including infection surveillance, and to influence government and policymakers. The recommendations formed after discussion with members will be discussed with MPs and other organisations to inform policy development. And then linked to the above is to amplify the college voice and members' expertise. So again, as has been mentioned earlier, medical microbiologists and virologists are key here. We need to highlight their key role and iterate this issue cannot be tackled successfully without them and the tools that they need. So these recommendations have been formed after discussion with members and their experiences as clinicians. So issues such as the lack of staff to carry out IPC and AMS, infection prevention control and antimicrobial stewardship, and the procurement of diagnostics have been discussed, and potential solutions formed that we can take to policymakers. So the asks that we have identified are workforce. In the UK, there's a 20% shortfall in medical microbiologists and a 14% shortfall in virologists. But we also need investment in the wider laboratory and infection specialist workforce to carry out antimicrobial stewardship and infection prevention and control. And then diagnostics. So we know rapid diagnostics can reduce the time taken to identify infections and to determine the correct antimicrobial to use. We need investment in their development, and we need to get them into the healthcare system once they are developed. But also where they are is important too. Where are they most needed? Perhaps in rural areas or areas where there is no daily transportation to the main laboratory for testing, for example. Then IT. So we have electronic patient records and laboratory information management systems, EPR and LIMS, also known as for short. So these give clinicians better oversight of the use of antimicrobials, better oversight, knowing which patient is on which antibiotic and for how long, whether it has worked and whether it hasn't worked, means better surveillance of resistance. And then leading on to surveillance. All of the above feeds into surveillance. Surveillance enables clinicians and scientists and government and policymakers to monitor infection resistant rates, to take this information and target responses to outbreaks, and then for governments to inform policy. And as Sally mentioned earlier, data is so important as it allows policymakers to shape action, to shape national action plans. So AMR is a One Health issue, of course. Involves, as we've heard previously, the environment and also animals too, which is why we're also developing a position statement focusing on animal health. And here we'll focus on alternatives to antibiotics such as probiotics, bacteriophages, metal-derived compounds, vaccines, rapid diagnostics again, stewardship, and our animal health laboratory infrastructure. So I'll now hand over to Natasha, and she can go into some detail on each of these recommendations and how they will help.
Thanks, Danny. So our biggest concern is workforce. We know, as Danny pointed out, that we have a shortfall in this. That data is from a 2021 survey we undertook with the British Infection Association, BIA. And what we're concerned about is there will be retirements. Does this mean we'll now have almost a 30% drop in workforce without replacing these staff? We need to look at skill mix. Where can we best use our staff and the types of staff we have? And the college is not able to do anything about increasing workforce numbers or training numbers in the UK, and obviously not globally. But what we can do is respond to government papers, for example, the 10-year plan, raising our concerns regarding workforce and how um, we can manage AMR and successfully if we have an adequate workforce, because AMR is an important part of our role as microbiologists and virologists, but it's not everything that we do. We also need good diagnostics as well. And so we do collaborate with other organisations. In the UK here, we have worked over recent years with the British Infection Association, the Hospital Infection Society, and with the Royal College of Physicians. And what we can do is try and produce guidance and documents that help us to either increase our workforce or to manage the workforce that we have as best we can. So with that in mind, we have obviously done the survey in 2021, and we're hoping to repeat that again early next year. We have produced, with the British Infection Association and the Royal College of Physicians, we've produced standard documents on what an infection service should look like. But in those are key recommendations of times. It is a UK-based document, so it's in sections of PAs, which is a 4-hour slot, of what we need to do antimicrobial stewardship, to do infection prevention and control. Because I think even with the pandemic, I think organisations do not realise just how much we do contribute to the management of hospitals and patients within them. And more recently, we've just published in the Clinical Infections in Practice online journal a document to optimise clinical activity. We've aimed to standardise the terms that we use for bedside reviews. What is a bedside review? What is a ward round? And also given tools to help us with our remote advice and other forms of clinical advice that we give. What is the minimum information we require so that we can actually optimise the advice and the care that we give to our patients? And with those, we're hoping that those also can be used as well as for education, but for commissioning of services, that we can point out the need to expand our workforce to be effective more than anything. Another thing that RCPath is doing is collaborating with the British Infection Association again, and the the Critical Care Society, Intensive Care Society, on standards for management of infection on critical care units. It is hard for us to understand workforce concerns outside of the UK, but we recognise that there are different concerns with our members, and we need to understand that. We also help by providing educational tools as well. And with diagnostics, we work with industry to see how we can collaborate in ways to help our members in terms of educational tools. And also, we really do seek to gain a reciprocal understanding of our relationship with diagnostics. It's not about privatisation, it's just about how we can learn from each other. And the statement is a way of raising our concern and needing to improve access to rapid and accurate diagnostics at the point of care if necessary, and reducing barriers to procurement, and reducing postcode lotteries. Where you live should not affect how you have access to diagnostics that are important for the management of infection, and that's globally as well as within the UK. Danny mentioned electric patient records, and those are really, really important to help us as infection specialists reduce our workload, reduce transcription errors, and also we can use the online guidance and advice tools which would help us manage our workload in terms of reducing the unnecessary phone calls, but also our users can help themselves by providing the necessary information, because we could provide a tool set there. Surveillance is important, and we've heard some excellent talks today, and Dr. Alanis mentioned the wastewater surveillance and the challenges of standardising and collecting data, I think it's important, and I think it's going to be a really exciting and important surveillance measurement in the future. And we need to have accurate surveillance, and we need to have targeted surveillance as well. And as Dame Sally Davis mentioned, we have to keep the momentum going, and providing statements helps us to keep the momentum going.
Thanks, Natasha. Also, so far, it has been UK focused. So to address the issues facing members in the UK, looking forward, we would like to develop a statement with an international focus and looking at how the UK can engage internationally and how the college can engage internationally, considering the differences in healthcare capacity around the world. So with lab infrastructure, as Natasha has been mentioned, waste management practices. This is really important. We know recently there was the high-level meeting on AMR at the UN, and they have called for financial support for countries in the global south who will bear the brunt of AMR if it is not addressed successfully. And before that, the UK actually announced a 39 million fund for AMR research through the government's Global AMR Innovation Fund. So leading on, really, this is an opportunity to work together after International Pathology Day to develop a statement, because these statements, recommendations, forms, they play an important role in engagement with policymakers in government and other organisations too.
Thanks, Danny. I'd just like to echo that. I mean, using International Pathology Day as a launching pad to collaborate with you on a global statement would be absolutely fantastic. We have the opportunity to learn from each other, and it's very much welcome. So thank you.
Thank you.